In our first community conversation today, we're joined by Dr. Kevin Volkema with Centera Martha Jefferson Family Medicine. He's sitting down with Casey.
All right. Thank you so much, Steve. Thank you, as always, for being here with us.
Thanks for having me back.
Yes, we are happy to have you. And we are in Men's Health Month right now. And you're here to talk about maybe aging, navigating aging in a healthy way. So based on your experience, how often should men schedule routine checkups as they're aging?
Yeah, great question. So ultimately it depends on the individual, their personal history, their medical history, their preferences. But I think once a year is an excellent starting point for most people.
Okay, good to know. Once a year is the way to start. Do you typically have suggestions on maybe dietary adjustments that can help to manage weight, even overall health in older men?
Yeah, I actually want to just start off and highlight the importance of lifestyle changes overall. A really serious and shocking statistic is 70% of adults are overweight in the United States. 70%, which is a really high number.
Yeah.
And although there's many factors that can contribute to that weight gain, I think an excellent place to start is evaluating the calories that you're taking in versus the calories that you're burning off. One little thing that I did want to highlight today, though, is the importance of fiber. Fiber is in kind of what we consider kind of real foods or natural foods. So vegetables, fruits, beans, whole grains, lentils. An individual going from a low fiber diet to a high fiber diet can decrease their cholesterol, decrease their blood glucose, decrease their cancer risk as well, and of course decrease their weight too. So the bare minimum for men, I would say, is 30 grams, but some studies suggest much higher than that as well.
All right, so so many good benefits of fiber. Any key indicators of cardiovascular health that men should be keeping an eye on?
Yes, I want to briefly highlight on 4 different ones.
Okay.
One is the number 150, and that's for 150 minutes per week of moderate intensity exercise. Ideally more than that, but that can be broken up, over 2-3 days or just a little bit every day. And that's because, when someone is able to exercise consistently, they're able to, train their heart, keep their heart and their lungs and their muscles healthy, and that helps them for a lifetime as well. The other important metric or indicator is blood pressure. And about half of adult men have uncontrolled blood pressure and they have no idea. This leads to increased risk of heart attack, stroke, dementia, kidney disease. There's a reason why blood pressure is called the silent killer. It's a big deal.
Yeah.
The third one is cholesterol. This is one that you have to go to your doctor for and you have to get checked. I do want to just highlight one test called lipoprotein A, which is a test that your doctor might not be testing. And that's a really important test to determine what your risk is for cardiovascular disease. And then lastly, it's not really a metric, but it's have you talked to your friends or family lately? So many men, especially as they age, become more and more lonely as time goes on. They lose contacts with their friends that they grew up with, maybe with loved ones, maybe with work friends. And so I encourage all the men listening to reach out to your loved ones.
Yeah, such good advice. As always, thank you so much for taking the time to be here today.
Thanks again for having me.
Yes.